Let's do a quick overview of the male genital organs, and we're really going to divide these into the internal genital organs and the external genital organs. Now, when we're thinking about the internal organs of a male, of the pelvis, these aren't really associated with reproduction. And so the largest things that you're going to find in this area are the bladder and the rectum. Also in this area, you're going to have some of those secondary sex glands. So probably the one that you've heard of before, you're going to have your prostate. You'll also have seminal vesicles. So let's find these in terms of here. So we're looking at a posterior view on this particular image. This right here is the bladder. It's been cut, obviously. You're going to have seminal vesicles on either side. These are going to meet up with the ductus deferens. And the ductus deferens, you may have heard of this as the vas deferens. This is where sperm is going to enter into this region. So the means of transport of sperm. So ductus deferens meets up with the ampulla of the duct in terms of the seminal vesicle. And then on this posterior portion of the bladder, you'll have the larger prostate, which is almost the size of a ping pong ball in this region right here. So what we were just discussing in terms of the ductus deferens, these are important ducts. The ductus deferens has both an internal route as well as it's going to be located externally, involved with the spermatic cord as well. Now, in terms of the external organs, you're going to have the scrotum. So this is going to be that sac-like region that's going to be posterior to the penis right here. Now, you can see in terms of kind of these ridges in the skin in this region before you really get into the scrotum, where that spermatic cord is going to enter the scrotum. And that spermatic cord plays a big role in terms of suspending the testes within the scrotum. So we're going to talk about each one of these organs or these areas individually, discussing not only just their structure, but as well as the vascular supply, as well as the innervation of these areas.